we are very delighted to have a special presenter who's come here to be with us. Michelle Neblett serves as the Director for Labor and Workforce Policy with the National Restaurant Association in Washington. She's responsible for issues such as healthcare, immigration, ADA, and education. While at the National Restaurant Association, she has held several other government relations positions, including lobbying on behalf of the restaurant industry on many issues. Before joining the NRA, she worked on legislative issues with the National Cattlemen's Beef Association. She's a graduate of Franklin and Marshall College in Pennsylvania. So please join me in giving a warm South Carolina welcome to Michelle Neblett.
I certainly enjoyed your hospitality day. It was great to come down and spend some time with y'all here and get a sense of what you all are up to. Get to see a lot of folks, talking to a lot of members of your legislature and their staff, and that's a good thing. So it's good to be politically active, and we just had about 580 folks up to DC for our public affairs conference, and that's an important part of our year in terms of political activity and educating lawmakers about the industry, because there's a lot to talk about. But today I'm here to talk about the healthcare law. As John said, I'm the Director of Labor and Workforce Policy for the National Restaurant Association. That means I'm a lobbyist on your behalf in Washington, D.C., before members of Congress and federal agencies. But the National Restaurant Association and our state partners also feel that it's very important to play the role of educating the industry about this law. Nobody would like for this to be happening, but it is the law, and so we've taken the stance that we're going to help educate and help you figure out what you need to do to comply with the law now that it's going forward. So this session today is educational in nature. Nothing that I say should be taken as legal advice or compliance advice. If you are looking for that, I would direct you to an attorney or a tax professional, depending on your questions. I'm not an attorney myself, but the association can't give that type of advice. So educational only, but we can tell you what's in the law, what's in the regulations. We've been very involved in terms of developing those regulations to try and make them as flexible as possible over the last 3 years. And we've had some wins and successes. So what I'm going to do today is walk through how you figure out how this law impacts you. And the first place to start is who is the employer and who's considered a large employer under the law. And we'll walk through that in a minute. We'll talk about some of the things that small employers and really all employers need to know in terms of what they need to do to comply with the law, because there are other things than just the employer mandate that you do need to worry about. We'll walk through the employer mandate requirements and some of the associated reporting procedures that will be part of that as well. And we'll conclude and finish with some things, a checklist perhaps, to help you going forward, as well as take some questions at the end. This stuff's complicated. The law is pretty complex, so bear with me. I will make the presentation available afterwards. If you do want the slides, I'm happy to do that. But bear with me as we kind of slog through some pretty complex information here for about an hour and a half or so, and take questions. Okay, so the first place to start is who is a large employer? And the reason why I start there is because that's kind of the dividing line. And this law has a new definition of who is a large employer. It's called an applicable large employer under the law. It's someone that has 50 or more full-time equivalent employees in business days in the preceding year. And that seems like it should be a pretty simple calculation, but there are some things to know about that. And this is a very specific calculation that was included in the statute of the law as it was passed. Very few things about the law are actually in the law. The Congress, I always say, kind of wrote the outline, and the federal agencies fill in all the details, and that's many times right now why we have a lot of questions and no answers. But they did include a very specific calculation in the law about exactly who is the large employer. But before you even get to that point, you really need to discern who you are as an employer. And many folks in this industry have multiple entities, different tax ID numbers, and a lot of folks think that that's how employer is defined. But the law actually aggregates employers. It's not based on tax ID or entity status. It's based on ownership and control. And this is a concept that's been in the tax code for quite some time. We haven't dealt with it so much in this industry because we don't have pensions or 401ks typically. But those who do may have run this test before, and it's something a CPA or a tax attorney should be able to do for you and will need to do for you if you have any question of this, because it is a little bit complex in terms of the rules. But say you have 3 tax IDs, 3 different LLCs perhaps, and you and your partners have control over all 3 entities, found that you're considered one, and so it's the employees of those 3 entities that must be combined into one pool that then is considered. And that's why this is important, because you're trying to figure out what pool of employees. Do I look at 3 different pools, or am I looking at 1 or maybe 2 and 1, depending. If there is any question about this, I do encourage you to talk to a tax advisor about this, because there's a matrix that they do need to run for you. They need to look at what you own, what you control, as well as what your partners own, and other entities that they may own and control. So it's a matrix that they've got to kind of set up for you and run the numbers to be able to tell. But a CPA should know this part of the code really well. It's section 414, subsections B, C, F, and O. And it, like I said, it's something that's been in C, F, and O. And it, like I said, it's something that's been in the law, in the tax code for quite some time. Once you've determined who you are as an employer, are you one or are you multiple, you next need to look at the hours of your employees. Full-time in this industry has a lot of different definitions, for sure. And it certainly isn't the one that the law set in stone. The law defines full-time as 30 hours a week on average in any given month. From the regulations, we know that the Treasury Department has given us a calendar month equivalency of 130 hours of service. Hours of service is not just hours worked, but it's paid vacation, for jury duty time, for military service, disability, any paid time off. So it's important to know that, because you're going to be needing to track these hours potentially, especially if there's any question. You might know your managers are definitely full-time and working way more than 30 hours a week, and you know that group. But then you're going to have a lot of maybe hourly employees for whom maybe there's a question. And so knowing who's who is going to be important. And for the first time, we have this very bright line as to what full-time is under the law. Part-time employees, it's important to know that you're going to be counting their hours and looking at their hours to determine your status as whether or not you're a large employer under the law. But at no time are you required to offer coverage to part-time. You're certainly more than welcome to, and they would encourage you to do so, but the law does not require you to offer coverage to part-time employees. And when you aggregate their hours of service for the calculation, you're going to only count 120 hours of service per person. So if somebody's working 128 hours in a calendar month, you're only counting 120 for the purposes of the calculation. And you'll see that in a minute when I walk through my example. We also have a lot of seasonal employees in this industry, and there are a couple of different definitions of seasonal employee in the law and the regulations, and this is one of them. This is one of the places it is in the calculation of whether or not you're large or small. And there is an exemption in the law and in the regulations that say if an employee, a seasonal employee who's working for you 120 days or less, triggers you to go over the 50 threshold, you're actually not a large employer because it was the seasonal employees that triggered that. So we'll walk through that. But this definition, 4 calendar months or 120 days, that equivalency is only used for this calculation. When will you do this calculation to determine if you're large or small? This is an annual calculation typically. This is something you'll do January to December to figure out the next calendar year and what your status would be for that entire year. But in 2013, they've given us some transition relief because they put the rules out January 2nd of 2013. So it's very hard to know how you were supposed to start counting January 1 if you didn't have the rules. So they've recognized this, and you can use any 6 month consecutive period in 2013, so as long as it starts before July 1st, or up to 12 months if you choose, but 6 months to apply that status for all of 2014. So folks, in my example, folks could choose February 1st to July 31st, and then take the time to work with a broker to figure out, now that they are large, if they figure that out, that they then have time to go through the process, run open enrollment, and get their employees in the plan and effective for January 1 under the law. The seasonal exemption is the example here, in that this employer had 40 full-time employees. This is the IRS's example, this isn't mine, so I know this isn't necessarily typical. But 40 full-time equivalents January through December, and 80 full-time seasonal folks each September, October, November, December. And so it was clear that those 4 months, the count was well over 50, and it was because of the seasonal employees that it was so. So even though the average here is 66 full-time equivalents, this employer is actually considered a small employer for the next calendar year because it was the seasonal employees that put them over the threshold to 50. I had a couple of questions. Yes?
Did I read somewhere where you subtract out 30?
That is only for the penalty calculation, and we will talk about that. It is not for this calculation to determine if you're large or small. Is there another one?
Michelle, there's a water urn in the back. Anybody want some water, please?
Okay, so looking at all of this, have you all determined whether or not you're large or small? I'm sure you've seen some of these numbers before. How many small employers, under 50 full-time equivalents, do we have in the room? Okay, good. And so everybody else is, I would assume, well over 50. How many are over 200 full-time employees? Okay, good, okay. That'll be important later in the presentation. So let's talk about the small employer impacts. And as I said, this impacts everybody, really. These are things that everybody has to abide by, regardless. So, but these are things that smaller employers need to take into account. And I'll talk about things that if you choose to offer coverage that you need to worry about. But again, you're under 50, you're not having to offer coverage to anyone. And some of the other requirements, some notices and taxes and things like that to be aware of. So I'll delineate that for you in this section. So as I said, small employers under 50 full-time equivalents are not subject to the employer mandates. So you're not obligated to offer coverage to your full-time employees, you're not obligated to offer coverage to your part-time employees. We'll talk about what options your employees do have in a minute, but you as the employer are not subject to the employer penalty. Again, we'll talk about the coverage and some of the other requirements. If you do choose to offer coverage, there is a business tax credit that's available. It is a 2-year tax credit for small employers, but it is fairly limited. It's 35% tax credit, but you need 10 or fewer full-time equivalent employees, and those employees are actually based on 40 hours a week. and there's a whole other calculation to that, or, and those employees have an average of $25,000 a year in annual wages. And you as the employer are paying at least 50% of the premium. Starting in 2014, if you do want to take advantage of this tax credit, to do that, you need to be purchasing coverage on the state exchange through the shop exchange. So this is available. I think it phases out up to 25 full-time equivalents and $50,000 in annual wages. So certainly for smaller employers, this may be an option. But I think many in the industry, just because of our labor and the amount of employees we have, I don't know that many will take advantage of it. Also, if you do offer coverage, this is something that applies to everybody. There's a maximum 90-day wait period. So gone are the days that we can say, after 6 months of working here, you're then eligible. It's now 90 days. So if you have somebody who's eligible for your plan, you have 90 days to get them in, whether you're a small or a large employer. There are other requirements when you're offering coverage. The summary of benefits of coverage. This is a document, a 4-page back and front document that everybody needs to be providing, every plan needs to be providing. This is just page 1. It basically is a comparison of the different plans, maybe if you're offering multiple plans, but even if you're just offering one, what's the deductible, what's the out-of-pocket costs, in-network, out-of-network. It's supposed to be a way for consumers to easily compare information, complicated information in the plan documents that you get when you do open enrollment. So something to be aware of, and just make sure that if you are fully insured and offering coverage, everybody, but especially small employers too, that your broker's helping you provide that, so you aren't subject to the penalties, because there are some associated. This law was really written to impact the individual and the small group market. Not the large market, not really the large employer market. So there are things there are reforms that you've probably all heard of, keeping somebody on plan until they're age 26, on their parents' plan, no rescissions of coverage, not being able to drop someone because of pre-existing conditions, things like that. Preventive services without cost sharing has been in the news in the last several months. So all these things that really change every plan out there. And insurance companies aren't going to be offering a plan that doesn't comply. And certainly that means changes to the plan and the plan design mean potential impacts on the premiums that we're all paying. Grandfather plans is an important one because some of these insurance reforms don't apply to grandfather plans. And especially small businesses, that's important in terms of being able to maintain potentially what you've been paying, your costs.